Hello, folks. Now we're going to do the flexors of the lower leg. So we're going to look at the muscles that help to create flexion at the knee joint and draw this lower leg up toward the glutes, right? So we got to start, we'll start here on the back. These are basically almost all of these flexors are on the back of the leg. Um, and the way that they can do that is they sort of originate in the posterior and then they wrap around to insert on the anterior portion of fibula and tibia. And so I've pulled off some muscles here. The glutes are gone. Um, and I pulled off a couple of these stabilizing muscles that really draw the greater trochanter into the pubis. And I want to zoom in a little bit as we look here at the flexors of the leg. So here's one, the semitendinosus. This is actually a fairly significant amount of this is tendinous, is this long tendon here, and much of the rest of it is quite flat. So this is the semitendinosus with, you can see its origin here. Hopefully you can see that. There's the sacrum. So its origin here on the ischial tuberosity, right? Origin on the ischial tuberosity, and 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 then the insertion. You can see it wraps around here to the front of the leg and inserts on this medial, whoops, it actually inserts in a very similar place to the sartorius and the gracilis. Oh, let me find that again. There it is. Okay, it inserts on this medial portion of the tibia, right? So very close to the insertion of these two adductors that we saw, or sorry, these two, this one adductor, the gracilis, and this other one, which ends up being another flexor, the sartorius. Okay, so that is your semitendinosus. Then next to that, we have your biceps femoris. This is another one of the hamstrings, and you can see that it's also originating here, right, on the ischial tuberosity, right there. And then this one is wrapping around and not terribly far forward, but far forward enough to insert on the head of the fibula. Right. There's a biceps femoris, uh, a short portion that has its insertion on the tibia. Where are we? The lateral condyle of the tibia. Okay. So this is both fibula and lateral condyle of the tibia for the insertion, right? So this is another flexor drawing the leg back. Now, if we take both of these off, we'll take this biceps femoris off. And well, first of all, biceps, right? Just like we had with the with the biceps brachii, right? Of the arm, biceps is two bellies, right? Same with this one, right? We've got this one and this one here, these two bellies of the muscle. So the biceps femoris, we had our semitendinosus with this long tendinous piece here. Now we're going to take both of these off and see underneath the semimembranosus. Now this one, rather than being tendinous and having a long stringy tendon, it has a broad, thick, flat membrane. So this is the semimembranosus, right? So there's our semimembranosus, another flexor. You can see again, insertion on the ischial tuberosity, or sorry, origin on the ischial tuberosity, and then stretches down, wraps around. Now to the front, not quite as far to the front as these others, but it's inserting on the tibia, right? And this semimembranosus is on more the posterior surface of this medial condyle of the tibia, right? And so that's another major flexor of the leg. And then one that we've seen before, we saw it last time, I included it, is the sartorius, and theirs should be our gracilis, right? A major adductor, and just anterior to that, our sartorius with its origin. Look at this, it wraps way around, right? Its origin way up here on the ilium, on the iliac crest, wraps all the way around to finally to insert more or less on the on the middle kind of in the middle portion, a bit anterior, but there it is, inserting on the medial, kind of anterior to medial surface of the tibia, and it's near this tibial tuberosity here where the major extensors are inserting. So there's our sartorius, right? Okay, and the action of all of these is to flex the lower leg. Now let's wrap around to the front here. We're kind of already there. And we'll get rid of this flexor so that we can see our major extensors of the leg. Get rid of our tensor fasciae lata, which is also a flexor. Now here's muscles that extend the leg, and we've got just 4 to think about here. Here's this big one, the rectus femoris, right in the middle, right in front, with its origin up here on this anterior, inferior iliac spine, right? And there's also, yeah, you can kind of see it branching here to also have a bit of an insertion on the acetabulum, so the upper rim of the acetabulum. So it's got these two, gosh, I keep saying that, origins. It's got these two origins there on the anterior inferior iliac spine and the superior border of the acetabulum. Now that comes down and inserts here on, I mean, you can see it kind of it inserts sort of on the patella, but then that whole thing, that whole tendinous sheath continues down to insert on the tibial tuberosity of the tibia via this patellar tendon, or sometimes it's called a ligament because it's actually connecting the patella to the tibia. So sometimes called a ligament, but this tendon is what connects to the patella. So that's our rectus femoris, right? And then we have internally, we have a vastus medialis, right, on the medial, on the medial position here, the medial side, sort of the femur. This is the vastus medialis, right? And this origin is along with the other vastus muscles, is much further down. It's actually on the femur. So the vastus medialis is having its origin kind of all the way along here. And if you can see, this is actually wrapping around to the back, right? So I'll show you that, but look at that. It actually originates on the back here, right on the linea aspera along basically its entire length, wraps around to the front to then insert again on this patellar tendon on the patella, which then is connected to the tibia via this patellar ligament. So that's the vastus medialis. Then we have the vastus lateralis, right? On the lateral side, that makes sense. This one has its origin here on, you can hopefully see the anterior aspect of the greater trochanter. Sorry. Yeah, on the anterior aspect of that, I'm looking at that correctly, the greater trochanter. But we also have, and it's not showing it super well here, but there's also some origin here on the linea aspera. So again, this has some origin. Now this one is much more lateral and then posterior, rather than the vastus medialis being completely posterior, right? So some origin here, and then again, it wraps around the front and inserts on the patellar tendon, which then inserts on the patella to the patella ligament, and finally to the tibial tuberosity, right? So for all of these, we would say it's the insertion point is really the tibial tuberosity because it's acting on the tibia, the tibial tuberosity via this patellar ligament. And then we got to get rid of some of these. We got to get rid of the rectus femoris, and there, once we do that, we can see this other extensor, the final extensor. This is another vastus intermedius, because it's right in between the medial and the lateral. And maybe we'll pull off this one. Okay, and this is really the only one. Yeah. This one has primarily, again, an anterior origin, and you can see here the intermedius is sort of the anterior origin on the anterior portion of the femur, but below, below, beyond or more distal to the neck. And then there's a little bit here. It's really on the kind of lateral surface of the linea aspera, right? But there's a bit of in origin here on the linea aspera, and that again connects or inserts on the patella and the patellar ligament finally to the tibial tuberosity. So these are all easy, all these extensors in terms of their insertion point. It's all on the tibial tuberosity via this patellar ligament. And all these vastus muscles have their origin, some part of their origin. In fact, all of them have some part of their origin back on the linea aspera, right? And the remainder on the anterior surface of the femur. So those are all the extensors and flexors of this lower leg, right? So I'll see you again in a few. Let's see, did I get them all? I got them all. Okay. I want to show you these now. I want to show you these. Let's look at our flexors first, our semimembranosus, just to peel all these away. I think you got a pretty good feeling for them, but here they are in Get Body Smart. Right, there we are on the origin on the ischial tuberosity, insertion on this medial, I'm trying to spin this and I can't, on this medial condyle of the tibia, and there is our origin and insertion, right? Okay, and then you can see that this is going to be flexion for all of these. That's the primary thing that these do. There's a little bit too of medial rotation, but that's only when the leg is flexed. So we're not going to even worry about that, as the primary action here is definitely flexion of the leg. How about the biceps femoris, the other one that's kind of on the outside that you can see, right? Biceps femoris. Pull that off and you can see the origin on the tibial tuberosity, and this time insertion here on this posterior lateral, kind of close to the linea aspera and the fibula, and here on the tibia, right? So this medial portion of the tibia and the head of the fibula. And here we'll pull that off and see. There we go. So there's our origin. There's our two insertion points, the head of the fibula and the posterior portion of this tibial condyle. Then we've got our semimembranosus. Where is our semimembranosus? Oh, this is the one we already did. Sorry, semitendinosus is the other one that's on the outside, right? Next to the biceps femoris. So peel that off. Again, great origin on the tibial tuberosity. This one wraps around rather than from the lateral side. This is to the medial side, right? And inserts more on the anterior surface of the tibia. So here's our origin and insertion, right? Origin there wraps around. That's not showing it, right? The origin wraps around to the front here and originates or inserts on the anterior portion of the tibia, very close to our gracilis and sartorius. And again, major flexor of the lower leg. And then our sartorius, who we've seen before, remember, originating up here on the iliac spine and inserting on this medial portion of the tibia, tibial condyle, right? Really long, thin, parallel muscle. Tibial tuberosity. I said the tibial condyle, but this is much more, even more anterior and sort of close to the tibial tuberosity where the patellar ligament inserts. Here we go. Here we go. Okay, so there's our origin on this iliac crest, and really it's very anterior on the iliac crest, so it's really we would call that I mean, it looks like it's more on the anterior superior iliac spine, and then sort of just below that. And then the insertion point here on this medial part of the tibial tuberosity, or just medial to the tibial tuberosity. Okay, then we've got our extensors. We'll do our vastus muscles first. Our vastus, what should we do here? Our medialis, that's the order we did this in. So our vastus medialis, right? So insertion, common insertion for all these on the tibial tuberosity via the patellar ligament. But there's that origin, right, on the anterior portion of the femur, right? So this is, we never learned the intertrochanteric line, but that's the primary anterior origin. And then the medial lip of the linea aspera. So we'll see if they flip it for us. They don't really, but down here would be the medial lip, and on the back side, right, the medial lip of the linea aspera. Then we've got our lateralis, right? There's our lateralis, with its origin a bit further up on the anterior portion of the femur, right? Kind of at this line between, they all originate on this line between the greater and lesser trochanter of the femur, right? So we can say that this one is closer to the greater trochanter in terms of its origin. And there they are, right? So this is the greater trochanter, but it's very close to the greater trochanter. And that's all of these are extensors, right? They're all extending the knee. And then our vastus intermedius, right? In the middle of all these, you have to pull away everything to see the vastus intermedius. There it is. And with our origin and insertion, right? All along this anterior surface of the femur, inserting on the tibial tuberosity. And of course, if we flip it around to the back, we'll also see an origin on the lateral surface of the femur, quite close to the linea aspera, so on this outside, and a major extensor of the leg. And finally, our rectus femoris, that big central muscle, extensor muscle that we can see, right? Pull off the sartorius. That's all we need to really pull off to see origin and insertion of the rectus femoris, origin and insertion. But we will take a closer look at that and see these two origins. Remember, we said the anterior posterior iliac spine, and then this superior rim or superior margin of the acetabulum, and then the insertion on the tibial tuberosity. And this is a major flexor of the thigh at the hip, given its position here on the ilium, on the pelvic girdle, rather than its position on the femur. So this ends up being a major flexor of the thigh at the hip. And it also contributes to flexion of this lower leg as well. Okay, that's it for our muscles of the leg. We had all of our flexors of the lower leg, including this biceps femoris, this kind of weird one that's on the front. And then on the back, our semimembranosus, semitendinosus, and our semimembranosus, semitendinosus, and biceps femoris. Then we had our, I think I just called this one the biceps femoris. I meant to say rectus femoris here on the front, right? The rectus femoris doing these two things, both extending the lower leg, but also flexion at the hip. And then we had all of our extensors of the lower leg here on the front, the vastus intermedius, medialis, and lateralis. And, ooh, what did I miss? A flexor, another flexor of the leg, the sartorius, right, which is starting up here and wrapping around medial, right? Okay. Next video will be muscles that act on the foot. So they're going to be all the muscles of the lower leg that then insert somewhere on the foot to the metatarsals or tarsals of the foot.